A patient was recently awarded $70.8 million for a malpractice case in Florida. You heard that correctly, $70.8 million. Will the patient be able to keep all that money? And what exactly happened? Let's get into it. Hey you guys, I'm Kay and welcome back to another episode of Munch and Medicine, where we munch and talk about medicine. Today I'll be snacking on some freeze-dried fruits, which is a healthier way to snack. What's your favorite fruits to snack on? Before we get into this video, make sure that you like this video, comment, and also subscribe or follow me if this is on a different platform. As always, I'll be giving you guys a brief synopsis of what happened, and then we'll get into the commentary. So based on news articles, this case occurred in 2021 and it involves a 38-year-old female. She was having the worst headache of her life and she told her 16-year-old son to call 911. She was then transferred to a standalone ER. So this is basically an ER that is standing alone. It's not connected to a bigger hospital where you can admit patients. The nurse practitioner that was taking care of her ended up giving her a headache cocktail, aka a migraine cocktail, which is used when patients have severe headaches such as a migraine. Above you can see the normal composition of a migraine cocktail, which may include a pain reliever such as an NSAID, anti-nausea med, anti-inflammatory drugs, ergots, and other medications. This composition is often utilized when a patient doesn't respond to other treatments. Despite having a history of diabetes and recent birth control use, which can increase the risk of clots, which can then move to the brain and cause a stroke, the patient was not giving a neuro consult and a CT scan was not ordered. After the patient was given the migraine cocktail, she was discharged after 4 hours. So the patient went home and 2 days later, she suffered a stroke. That headache came back. I'm not sure if it ever left, but she was admitted to the main ER and she was given the gold standard treatment, which is the treatment she should have gotten in the first place. So she finally received the CT scan and it was discovered that she had a stroke. Even though she was treated, she was left with deficits as a result, including left side blindness and hemiplegia, which is paralysis on one side of the body. The patient ended up suing the hospital and the nurse practitioner because she felt like if she received that original CT scan when she went to the standalone ER, she would not be suffering from the deficits that she did because they would have found out that she was having a stroke and she would have been treated accordingly.